Hi, my name is Ed Rodriguez. I'm a nurse here at Cardiopulmonary Rehabilitation, and I'm here to give you a presentation on medication management. The presentation is going to be broken up into three parts. Preferably, we'd like you to watch the whole thing at home. It takes about 45 minutes or so. If you want to watch it here while you're on a recumbent bike or something like that, you could probably break it up into three different parts. So I'm going to have an end of part one, end of part two, so that way you know where you stopped if you're on the bike and you want to get back on there and watch part two or the final part, whatever that you want to do. It's just an easier way to do it, so that way while you're exercising you can learn as well. So medication management, there's some different rules that you should keep for medication management. Keep in mind, you're going to keep a current list of all the drugs you're on. That's very important to do that. That not only you have it, but family or friends have it as well. So that way, in case you can't speak for yourself, they're aware of that. You want to keep all your doctors up to date on any changes. Different providers sometimes don't talk to different providers. So you are the go-between between those providers to make sure that they are aware of what medicines that you're on. So that way everyone is on the same boat, so to speak, and aware of your medications, the amount, and so on and so forth. Know the important points about your medications. There are certain things that each medication holds dear and valuable, different side effects, different things like that, that it's important for you to know what to expect for each medicine. Remember the side effects that you should expect. Every medicine has a side effect. Some people will not experience any of these side effects. Some people will experience all of the side effects, but just be aware that you will or probably will have some of the different side effects, and you should be aware of that. Know the danger signs and when to call your doctor. Different side effect doesn't necessarily mean that it's emergency or urgent to get somewhere or to talk to somebody, but you just want to know where the danger signs are in case you do need to do that. Take your medications exactly as instructed. Don't take them as you wish to take them. Take them as you should take them. And there's a reason why they are prescribed a certain way to enhance something or deter something. And your health depends on you. It's important that everyone knows the medicines that they're on, the doctors that they have, different things like that. Not just your spouse. It's important that you are aware of that, and it's very important to know all these different things because not everybody is available whenever you need it. So you having your own knowledge base is extremely important. So the first thing, keep a current list of all your medications with you. Whether you want to do that on a phone or whether you want to do that on a printed list, it's strictly up to you, but you should have a current list with that. Some people like to write a list out, take a picture of it on their phone, and then they can save it as a favorite. So that way they can go to that information whenever they need to. Whether it's at the hospital, whether they're just at a doctor's office, or whether they're at some test that they need to know what kind of medicines that they're on. It will not only be a daily checklist for you, but allows easy access if there is an emergency or any time you seek medical or dental care. A lot of people forget all about the dentists. The dentists are doctors as well, and some of the different things that you are on will definitely affect your dental care. Whether it's a blood thinner, whether you need to be on an antibiotic because you have cardiac issues, there's a direct correlation between cardiac and dental care. And a lot of people don't know that, but the dentists know and the cardiac folks know. So just keep that in mind. So you should know your medications. What are the brand and the generic names? I'm going to tell you from the get-go. I'm going to start saying some names later on that I can't even say, and I've been doing this for a long time. So figure out the name and what it's used for. There's multiple names that these medications have, so figure out what's easiest for you to remember. Why are you taking this drug? Just because you're taking a certain medication doesn't necessarily mean that you know what you're taking it for. You should know what each medication is for, why you're taking it, and the amount of dosage for that you were supposed to take. The easiest thing to do is to, on that medication list, write the name of the medication. Then you want to make sure that you write the dosage, when you want to take it, and why you're taking it. Another little column you can add is who prescribed it for you. Should it be taken with or without food? Some medications are better without food on an empty stomach. Some medications are better with food. So it all depends on what medicine that it is. A lot of that information can be found in in the education pamphlet that they give to you at every pharmacy whenever you get those medications. And if you don't know where that is, or the fact that that thing is way too long, there's a lot of information that is out there on the internet. I wouldn't delve too deep in that because you can go forever and ever and ever in there, but there's different websites, PharmMD, Mayo Clinic, different things like that, that you can look up different medications and find out what it's there for and some of the different side effects and such. Speaking of which, what are some of the important side effects that may occur? Every medicine has a different side effect. It all depends on what kind of side effect that you get specifically. Everybody has different types of side effects. What affects my stomach may not affect your stomach, so on and so forth. So you just have to be expected to know what some of the side effects are. When do you notify the doctor about possible harmful side effects? If you're getting nauseous with a medication and it's making you miserable, you might want to call the doctor. If you get a little queasy every once in a while, I don't know that that's important enough to come off that medicine. You also want to think about how long you're going to be on a certain medication to find out if you want to come off of it or if you should stay on it. Most of the time, the doctors and the providers put you on that medicine because you're supposed to be on it, because it's best for you and your health. So, but you should know some of the possible harmful side effects. Which type of doctor prescribed? You've got cardiologist, pulmonologist, family doctor, nephrologist, hematologist, any type of ologist that you can think of. And it's important to know who prescribed it. Just because one doctor prescribed it doesn't mean that everybody knows that you're on it. So my cardiologist may give me something that my family doctor doesn't know about, and that my family doctor may want to try and put me on the same thing or something in the same family. So it's important that they are aware. That's why it's very important to keep that list up to date. Whenever new medications change, it's important for you to change your list and for your providers and your healthcare folks to know. That's why we need to know here at Cardiopulmonary Rehab, is because that's going to change different things, your heart rate, your blood pressure, sometimes your temperature. A lot of different things can change depending on just a simple dosage change for your medicine that you're on. What are the drug interactions? So some medications you should not take alcohol with, or shouldn't even get close to alcohol. Some medications you're okay to drink with milk. Some medications you can't drink juice with them. So all that information is inside that pharmacy information that you get whenever you get it prescribed to you. That packet, that long piece of paper that they usually give to you, there's drug interactions that are on there. There's usual dosage that are on there as well. Don't delve too deep into some of those different things though, because a lot of that stuff can kind of freak you out a little bit. And you don't want to get anxiety over a medication that you're starting to take unless it's causing you issues. I understand. Can the tablet be broken or crushed, or can the tablet be opened and mixed with food or beverage? There's some folks that have a hard time swallowing pills. I understand. Some of the pills are massive horse pills. So you may want to break it up, cut it open, make it a little bit easier to swallow. Some of those medicines you can't do that because it breaks up the efficacy of it. It doesn't work, or it causes GI issues. And you want to make sure that each one that you are going to cut open is okay to cut or to chew or whatever that it might be. Keep that in mind whenever that you're looking at your meds. Call your doctor for new symptoms. So different symptoms that you want to get in contact with the doc. Skin rash, hives, or itching. Nausea, vomiting, or stomach pain. A lot of times GI issues happen with medications as well. Severe headache, unusual tiredness or weakness. Those different things can happen depending on your medicine that you're on. Yellow eyes or skin. Breathing difficulty or unusual coughing. Sometimes that can be caused by an anaphylactic reaction. That's very dangerous, and we want to make sure that you're safe. You start having that after the first time you start taking a medication, you may want to just skip your doctor and might want to call 911 depending on how you're feeling. Anaphylactic reaction can close up your throat, it can swell everything up, and you'll have a hard time breathing. Very important to keep an eye out for that with new medications. Ankle, feet, leg, mouth, or hand swelling. With all that swelling, sometimes fluids building up inside your body. And those different swelling, the swelling that occurs there can be just a precursor to other issues that you're dealing with. And we'll talk about that a little bit later. But if you have any of those, you want to talk to your doctor about it. Chest pain or tightness, that goes without saying, right? Unusual bleeding or bruising. A lot of the times, many of the people that come into the program have had heart attacks, have had stents, they're on blood thinners, they're going to have bleeding, and they're going to have bruising sometimes. This is unusual, excessive, to where it just continues on. Fever or chills, might be at risk of having an infection if you have something like that. Difficulty speaking or swallowing, that again goes back to a possible anaphylactic reaction. Dizziness or fainting, diarrhea, again, GI issues that you're dealing with, or abnormal heart rate. Those things can be definitely need to be talked to with your provider about. So what we're going to talk about is we're going to talk about all these different types of medications that a lot of you people are on. Anticoagulants, antiplatelet agents, angiotensin converting enzyme inhibitors, angiotensin 2 receptor blockers or inhibitors, angiotensin 2 receptor blockers in combination with neprilysin inhibitor. It's a mouthful, isn't it? Beta blockers, calcium channel blockers, diuretics, vasodilators, antiarrhythmics, statins or other cholesterol-lowering medications, SGL2 inhibitors. So all these different medications, many of you are on maybe one of each. I'm sure you probably feel that way with the amount of medicines that you're on. You're not alone in that boat. Lots of people are on a lot of these different medications. What we try and do here is we try and help you educate you with the medications and help you with the exercise to maybe at some point you might be able to come off of some of these. At some point you may not be able to. It all depends on your diagnosis and how you're getting along. But it's a goal of ours to try and see how many medications we can get you off of while you're here. The ultimate decision maker is going to be your provider, you and your provider, to have conversations about that though. But we're going to touch on all of these different medications. This is the end of part 1. So if you want to skip ahead to part 2, you're more than welcome to, but I'm going to continue in just a second. Part 2, let's talk about those different medications. Let's talk about first anticoagulants. So anticoagulants decrease the ability of the blood to form clots. They do not dissolve existing blood clots. So they're not something there to break a blood clot up. They are there to decrease the ability of the blood clots to form, all right? They help to prevent harmful clots from forming, such as in an ischemic stroke or TIAs, those are clots to the brain. Pulmonary embolisms or PEs, those are clots to the lung. Deep vein thrombosis or DVTs, those are clots to the rest of the body, usually in your legs. You can get DVTs in your arms, but most of the time it's in your legs. May prevent existing clots from becoming larger and causing more serious problems. Often prescribed to patients with atrial fibrillation or patients who have had a DVT or a PE. So, how do we know what those medications are? We have a list over here on the left-hand side. Warfarin, the old standby, apixaban or Eliquis, Pradaxa, Xarelto, and a new one that's out there, Endoxiban. So you can see most of the ones end with ban or an. Those are different anticoagulants, okay? There's also a couple, those are pills by the way. There are a couple injectable ones, Lovenox and heparin. Those are not given out as often as they used to be, but there are some people that are still on Lovenox shot and have to give it to them, or a heparin shot, have to give it to themselves in the stomach and subcutaneous fat there. So keep in mind, anticoagulants do not dissolve existing blood clots. So just because you are on an anticoagulant doesn't necessarily mean that if you have a blood clot, well, I'm on an anticoagulant, I'm on Coumadin, and it should get rid of that blood clot. That's not what it's designed for. It's designed to prevent those different things. And you may still have clots that form, even if you're on this. It's helpful. It's a whole lot helpful, but sometimes they still do form. So a couple of the takeaways from this, So clots that form in the brain, stroke, or TIAs. So that's why you need to be on anticoagulants. PEs are for your lungs, and different signs and symptoms. Stroke, different signs, start slurring the speech, maybe you starting to forget words, leaning one direction, and your face kind of droops on one side. PE, you'll start having difficulty breathing, and it could be sudden, to where you're not doing anything, suddenly you just start having a really hard time breathing. Those people that get the breath back after a minute or so, it's probably not a PE, it could be something else. But those that are still continually having a hard time to breathe, it's important to get that checked out. DVTs, deep vein thrombosis. Most of the time with those, you have to get an ultrasound to make sure that you don't have a clot in there. If you throw a clot even down in your legs, that could easily travel up to your brain or up to your lungs. So those different things are important to avoid, and that's why folks are on anticoagulants. Antiplatelet agents, they keep blood clots from forming as well by preventing blood platelets from sticking together. They make things slicker, so to speak. Aspirin. So most everyone that we have here are on an aspirin. Unless you're allergic to it, you're on an aspirin. Clopidogrel or Plavix, Prasugrel or Effient, Ticagrelor or Brilinta. Those of you that have had stents are probably going to be on one of these, if not two of these. It's just a common thing. A lot of the times, patients can stay on it for a certain amount, 6 months, 12 months, and sometimes the provider will take them off of it, so that way they don't have to be on it again after a certain amount of time. For patients who have had a heart attack, unstable angina, ischemic strokes, TIAs, transient ischemic attacks, or mini strokes, and other forms of cardiovascular disease, the provider will have you on these different medications. Only prescribed preventatively in certain patients that are at high risk for a stroke or a heart attack. Not everyone is on this, but a lot of you people are on this. So again, with these and the anticoagulants, you're probably going to have some bruising. Whenever you just basically scratch yourself, you're going to bleed a little bit, so you have to keep that in mind. That's why a lot of the times folks that are on it, they want you to avoid any type of physical contact, such as if you play hockey. I know one of our patients was a hockey player, and they're like, can you stop that for a little while? If you're engaged in bullfighting, we don't want anybody to be on antiplatelets or anticoagulants when they're bullfighters. Different things that can cause you to have bleeding real easily. That could be something as easy as working in a farm. You have to be really careful when you're doing yard works too, because scratches and bumps and bruises just kind of happen when you're doing those different things. Okay. Now we're getting some more into some of the angiotensin or the ACE, ARBs, beta blockers, things like that. So angiotensin converting enzyme inhibitors, or ACE-Is, they expand blood vessels and decrease resistance to allow better blood flow. So it's kind of opening things up to make it easier for the blood to go through. The heart works easier and more efficiently with better blood flow. So think about, you have a pipe this big, it's easier to have fluid going through there than a pipe this big, right? Used to treat cardiovascular conditions including high blood pressure and heart failure. They also help protect the kidneys. Some commonly used ones. These are the prils: benazepril, captopril, enalapril, fosinapril, lisinopril. So all of these are the prils. You can see the other names on there: lotensin and vasotegmopril, different things like that. Those are ACEs. Not everybody can take an ACE or an ARB. They have different side effects. So again, talk to your provider if you start having any type of unusual feelings or anything like that. Some less common ones. I'm not even going to mention those because I don't think I've ever actually seen those. Next one, angiotensin II receptor blockers, or ARBs. They expand the blood vessel, decreasing resistance to allow better blood flow. Very similar to an ACE, right? The heart works easier and more efficiently with better blood flow. Again, very similar. They're used to treat cardiovascular conditions, including high blood pressure and heart failure, and they also protect the kidneys. So these are very similar. Sometimes they work in conjunction, sometimes one at a time. These are the ANDs, losartan, valsartan, olmesartan. See, I have a hard time saying it just like you guys do. So these are used in conjunction with other medications to help make it easier for the heart to beat. Give as much relief to the pump as possible, because we want the pump to be kind of in a chill mode, especially after we have an issue. Beta blockers. A lot of folks that come in here are on beta blockers. They decrease the heart rate, which lowers blood pressure and allows the heart to beat more slowly with less force. More slowly with less force. Well, what does that mean? That means your heart rate is going to be slower than what it normally is. It wants to give the heart a chance to recover. That's what beta blockers do, basically. It gives a chance the heart to chill for a little while. A lot of folks are on this after they have open heart surgery, because the heart doesn't like to be messed with, doesn't want to be poked and prodded and touched and cut and all that other jazz. So it gets irritated. It gets a little irritated. The beta blocker is going to say, all right, dude, calm down. Everything's going to be okay. And it calms it down, and it helps your heart recover a little bit quicker. Commonly used to prevent future heart attacks in patients who have had a heart attack. Control the heart rate in AFib, or atrial fibrillation, and it's a mainstay in a heart failure to allow the heart to rest. Like I was just saying, it helps with the chill. Atenolol, bisoprolol, carvedilol, these are the LOLs. These are beta blockers. What happens with a lot of folks that come into the program is they're going to be on these different beta blockers, and then we're going to test you. What do we want to do? We want to see your heart rate go up, right? But you're on a beta blocker. So how do we fix that? Well, that's when we go by your exertion level and your breathing level. Even though your heart rate, we want your heart rate to get up to 100, but your heart is saying, I'm only going to 80, dude. I'm on a beta blocker. I'm not going to go any faster. That's why we ask you, how hard is something? How difficult is the breathing? We want to hear about your exertion level to see if your exertion level is equating the amount that you should be. We want you to work hard in here, but not really hard. We want it to be somewhat hard. That's why we ask you those different questions all the time. It's good for you. It's good for your heart. So that way, once you do come off the beta blockers, if you are able to, then your heart is already ready to go. Think of it as spring training kind of thing. It's ready to play ball, right? So that's why beta blockers it slows it down. They're designed to slow down your heart rate, so that way it can recover a little bit easier. Calcium channel blockers, they decrease blood pressure by relaxing blood vessels and allowing the heart to pump at an easier rate. So again, this is something else that kind of relaxes the blood vessels. Used to prevent future heart attacks in patients who have had a heart attack. High blood pressure, chest pain, and some arrhythmias. These different calcium channel blockers can help treat all of that. These are the penes, amlodipine, nicardipine, nifedipine. All these different penes are the calcium channel blockers. So a couple of different ones that we don't really use a whole lot anymore, diltiazem and verapamil. Those are a little bit older, and so we have newer ones that are out there. There are still some folks that are on those medications, and if it's working for them, hey, that's fantastic, and we want it to keep working for them. But this is just one of those other heart-healthy medications that helps things out. So this is the end of part 2. If you're going to continue to watch, please continue to watch. Otherwise, have a great day. Next section of medications that we're going to talk about, diuretics. So, diuretics. Good, bad, terrible, amazing. Diuretics. What they do is they cause the body to rid itself of excess fluid and certain electrolytes through urination. So when we ask you, how's your urination going? That's what we want to know. And most of you that are on diuretics are going to tell us it's pretty frequent. The diuretic is doing that. It's causing this excess fluid to get off. A lot of people that have heart failure are on diuretics. The diuretic is going to get rid of that fluid from around the heart. It's going to get rid of that fluid that's swelling up your ankles or swelling up your stomach, or some people get swelling in the face from it as well. That's just the fluid that's building up inside of you. Diuretics are there designed to go ahead and get rid of that and help take it off of your body. That's why we ask you your weight every day you come in. That's why we want to find out. An increase in just a couple of pounds overnight can be the precursor to a heart failure episode, and we want to avoid that. That's why when you come in and you check your weight and you're 5 pounds up and it was just a day ago or 2 days ago, we want to know, how are you? What's going on? Is it medication related? Is it heart failure related? Is it because you went to Popeyes and went crazy with it? That's why we ask you. It's not to try and embarrass you or anything like that. We want to find out if there's an underlying cause, which maybe you may need to be on a diuretic for. And if you are on it, maybe it needs to be increased. It helps to relieve the heart's workload, helps lower blood pressure and reduce swelling from excess fluid in the body. So some of the common ones, furosemide. Everybody's on furosemide. It just seems like everybody's on furosemide. Bumetidine, spironolactone. Lots of people are on the spironolactone. Hydrochlorothiazide. That also helps with blood pressure as well. So all those different medications, we're lowering the amount of resistance that's in there because we're getting rid of the fluid, and this is gonna help with everything overall, except for your bathroom habits, unfortunately. Vasodilators, they are used to relax blood vessels and increase the supply of blood and oxygen to the heart while reducing its workload. So, vasodilators, they're great and they're a little bit scary all at the same time. Nitroglycerin. People have nitroglycerin or the nitro tabs in case they have chest pain. It's used to relieve chest pain or angina. That's great. If you have chest pain and you need to take nitro, we need to know that you need to take a nitro before you take the nitro. We've had patients that have come in here that have had chest pain, have not told us, popped the nitro, didn't tell us, next thing you know, they're on the floor. Nitroglycerin is a medication that will drop your blood pressure pretty quickly too, because of what happens. It's supplying, increases the supply of blood to your heart while making it easier for it to beat. Basically, is kind of it. So that's going to decrease your blood pressure. I've seen blood pressure drop from 180 down to 90 in literally 1 minute because of the nitroglycerin. It's important that we know you need to take it so that way you can sit down and we can be there to check your blood pressure to make sure you're okay. Out or at home, if you ever need to take it, you need somebody else there with you. You need to tell them, hey, I'm having chest pain. I need to take this nitroglycerin tablet. And it's 1 every 5 minutes up to 3. Just keep that in mind. 1 every 5 minutes up to 3. Okay? So if you don't have anybody that's there, grab a stranger. I don't care. Just grab somebody and say, hey, come here. Do you have a cell phone? Sit with me while I take this nitroglycerin. If I pass out, call 911. All right? You may need to do that anyway, depending on how the chest pain is. It can come in a pill, which most of the nitroglycerin comes in a pill. Sublingual, it goes underneath your tongue. Chewable tablet, or even a topical cream. Some people have to wear nitro patches because they have frequent angina that continues on. Some other medications that are vasodilators, isosorbide. People are on that, so that way maybe they don't have to take the nitro when they're having the chest pain. Isodil or isosorbide lasts throughout the day. Hydralazine and isosorbide is a mainstay for heart failure treatment in the African American population. That is something that most African Americans are going to be on if they are having heart failure. It just works better for that population. Antiarrhythmics. So there are different antiarrhythmics used for AFib to correct the rhythm of the heart. Correcting heart rhythm reduces risk of stroke and heart attack by reducing the chance of blood collecting in the heart. So an antiarrhythmic, somebody has AFib. What happened is So let's imagine this is, so we have four chambers of the heart. We have the ventricles, we got the right ventricle and the left ventricle, and we have the atrium. We got the right atrium and the left atrium. Most of the time, our things are going like this, right? We're squeezing, 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 squeezing. AFib, your heart's kind of doing one of these things. It's saying, I don't really want to squeeze. I'm kind of lazy right now. I'm just kind of fiddling around, just messing around here. So what happens is the blood that's in there, not all of it is getting out. It's developing, it's kind of pooling. It's pulling up a little bit there. So what do you want to do? You want to get that blood out, right? So we want to stay in a good rhythm. Amiodarone is one that really works really well. So does flecainide. All of these actually work very well to keep you out of this and into this, all right? Because if you have that, you have a very high risk of having a clot, throwing a clot. And like I was saying earlier, clot's no good, no bueno. All antiarrhythmic medications have several drug interactions and adverse effects. Your provider should know each medication that you're on. That's why it's important. Every provider knows every medication that you're on. That's why you have a list. We got back to my first point. Digoxin is usually last line therapy with many interactions and monitoring requirements. So if you're on digoxin, you probably already know this, but there's a lot of different requirements for DIG. You have to go in and get labs drawn, just like Coumadin and things like that, to make sure that you don't get toxic and make sure that the levels are good. That's why a lot of people, most providers are moving away from digoxin and going to one of the other antiarrhythmics. Cholesterol-lowering medication. There's a lot of different cholesterol-lowering medications. Various medications can lower cholesterol levels. They can be prescribed individually or in a combination with other drugs. Most of the time, they're in combination with other drugs. Some affect the liver, intestines, and formation of cholesterol from circulating in the blood. So, depends on the different medication as far as for where it's working, okay? Used to lower the LDL, which is the bad cholesterol, and raise the HDL, which is the good cholesterol, and lower the triglycerides, which help clots form. Basically, that's kind of what triglycerides do. They help clots form. Statins. Everybody is on a statin, or has been at one point, if they have high cholesterol. Different things that happen with statins. Joint pain. A lot of people get shoulder pain, neck pain, different things, stiffness, things like that. So that's why they started developing different medications, such as Zetia. Zetia is a really good medication for cholesterol lowering. It really helps. Some of the other ones that are out there, Welchol, that's one that really helps as well. There's other medications that are going to help with cholesterol, including niacin, and then the omega-3s. That helps as well. All these different things, Repatha, all these different medications are going to help with lowering your cholesterol. It's important to keep an eye on your cholesterol with your yearly checkup through your PCP, and most of the time your pulmonologist or your cardiologist will want to have that information as well. SGLT2 inhibitors. These are the newest fellas on the block. Jardiance, Farxiga, I'm not even going to say it, and Invokana. I haven't really heard of that other one. So those are the flozins. Many ways to help improve the heart function, but they're not completely understood. One thing that is understood about these SGLT2s is that it helps with folks with CHF, congestive heart failure. It helps folks that have chronic kidney disease, and it also helps folks that have diabetes. There's new studies that are out, just recently published, that say people that have all three of these, which a lot of our patients do, should be on one of these SGLT2s, because it affects all of these and is a benefit to all of these, including to help with your blood sugar with diabetes, and including to help improve your chronic kidney functions. So if you're not on that and you're curious about it, talk to your provider about it and have that conversation to find out if there is something that you might be able to be on to help with that. So one of the other things that a lot of people don't understand is some people are on an iron supplement. Why am I on an iron supplement? Well, These are used to replenish the body's iron reserve, which, when low, can cause fatigue, weakness, headaches, and more. Anemia and iron deficiency are frequent in adults with heart failure. So this happens with heart failure a lot. A lot of people that are in heart failure are anemic. Patients with heart failure who have iron deficiency anemia or iron deficiency without anemia should receive iron and should be evaluated. A lot of people that come in here that are just worn down and things, and the next thing you know, they go to their doctor and their doctor said, well, you're a little anemic. We're going to go ahead and send you for a iron infusion. We see that quite a bit now with our patient population. Doesn't mean it's going to help everybody, but it does help a lot of folks. Something to have a conversation with your provider. You may need to take supplements for several months or longer to replenish your iron levels. Commonly used, ferrous sulfate, ferrous gluconate, all of these are just irons that your provider may put you on. One thing about, if you're on iron, it could cause constipation. So keep that in mind, that if you're on an iron pill, you might need to be on a stool softener or something to help with constipation as well, okay? That concludes my class on medication management. If you have any questions, we'd be happy to answer them for you here. You can talk to myself, or you can talk to Trista, or Susan, or Courtney. And if we're not here, we're all the nurses here. And if we're not here, then you can ask any of the staff members here. If they don't know the answer, they'll come to us. If we don't know the answer, we'll figure it out. For more information, please visit the American Heart Association website at www.heart.org or contact your physician. Always keep in contact with your physician. Don't wait until their office calls you and says, hey, it's been 3 years since we've seen you. Make sure you get your yearly checkups, okay? Thank you very much.